Alright, today we're going to be doing an inspection of the peripheral vascular system. First we're going to do the upper extremities, then we'll move to the lower extremities. I'm going to just start by doing a simple inspection bilaterally, both arms. So I'm just going to be looking at skin color, any hair patterns, muscle tone. I'm going to look all the way from the fingertips all the way up to the axilla. No bruises, nothing. Everything looks really good on that arm. Got a little bruise here. Nothing I'm too concerned about though. Color looks good. So the next thing I'm going to do is just check your temperature, compare one side to the other. So I'll have you hold your arms out and just run the back of my fingers along the middle of the arm, or inside, and then all the way down the outside. Everything feels normal. Now I'm going to just look for signs of cyanosis. So I'm going to be looking at the patient's lips, looking to see if they're blue at all, which they're not. Looking at the patient's fingertips. They're nice and pink. Good. And now I'm just going to do a simple nail compression test, making sure that when I squeeze it and the blood leaves, when I release, I'm looking for the color to return back to your fingertips. And you do that on a couple fingers, and color comes back almost instantly. So nothing to worry about there. Next, I'm going to be just doing some palpation of the pulses. So I'll just have you stick your arm out, and then I'm going to check the. Actually, I'll do bilaterally because I'm assuming that the vitals have been done by now. So bilaterally check the radial pulse, very symmetric, and then go to the ulnar artery, very symmetric. Now just let the patient's arm hang loose and do the brachial artery underneath the biceps. Very good. And then other side. Good. Now we're going to do what's called Allen's test. So I'm going to have you hold your arm like this, make a fit, or pulse your hand like this, and then make a tight fist. Now I'm just going to cut off blood flow from the radial and ulnar arteries, have the patient open up their hand. It's nice and white. I'm going to release only one of the arteries. So there I did the radial, and color flowed back in almost immediately. Do that again. Make fist, cut off circulation, open up, and then release the other artery. And blood flow you should see return within about 5 seconds, and it does. No problem. You can do the other hand. Make a fist. Open. There, I did the ulnar first. One more time. Open. And radial. Everything looks really good. Now we're going to be checking the lymph nodes. They're a little bit tougher to feel. They're supposed to be really small and smooth and round. Just let your arm relax. I'm going to start out with the epitrochlear lymph nodes. So this is pretty much right by the radial, or the brachial pulse here. So just feel around for it. If you can't feel it, it's alright. Means nothing's going on. So now we'll move to the axillary lymph nodes. There's an anterior, posterior, a medial, and a lateral lymph node. So I'm going to raise the patient's arm up, start out with the anterior. See that? About right underneath the pectoralis muscles. Feel around in there. I'm going to move to the lateral, so you have to get up in the armpit here. It's kind of uncomfortable, I know, but then lower the arm so I can get up there further. Just feel around. Nothing. Raise your arm again. Feel the medial. Lower the arm. And one more time, posterior lymph nodes. And that's right anterior to the scapula, and then lower the arm. Get up in there. Alright, everything feels good. So now we'll just move to the lower peripheral vascular test. So I'll have you lay on your back. Make sure that the socks and shoes are off. I'm going to have you pull up your gown and roll up your shorts for me, alright? Roll them all the way up. I'm just going to start out by doing a simple inspection, checking all the way from the inguinal ligament all the way down to the bottoms of the feet and the toes. I'm looking again for just color, any hair patterns, bruises, swelling, anything like that, muscle tone. Checking the whole entire leg. I noticed she has a bruise here. You must have just bumped into something?
Yeah, just a couple of days ago.
Nothing too concerning there. Bottom of the feet. Make sure you check the medial and lateral aspects of the leg as well. Everything looks good. And while I'm down here by the toes, I'm just going to do another nail compression test. So just like the one for the fingers. And they're a little bit slower than the fingers, but nothing that I'm concerned about. The color does come back almost immediately. So the next thing I'm going to do is just check for signs of pitting edema. So if I notice some major swelling in your legs, there are 3 points that I would squeeze. One is the top of the foot, and let go. And if she had pitting edema, the compression of my fingers would be very evident. They would stay there after I released. And then I would check by the medial malleolus and the surface of the tibia. And everything looks really well. So now we're going to just check some pulses here. Starting out with dorsalis pedis on top of the foot. I can do this bilaterally. Checking for symmetry. They're very symmetrical. Move to posterior tibial, which is behind the medial malleolus. Very good. Now we'll move to the popliteal artery. Have the patient bend their knee, and you get behind, right behind their kneecap pretty much. Feeling for the popliteal artery. I feel like it's more on the tibial side more than the femur side, and a little more medial as well. Very good. And do this both sides. Very good. Now I will be looking at the femoral artery, and that should be right between the ASIS and the patient's pubic symphysis. So I will have you go ahead and find your pubic symphysis for me. Alright, and I found the ASIS, and it's about halfway in between, so right about here. And I feel it. Now the other side, if you could find that again for me. Halfway. Very good. And now while I'm up here, I'm just going to feel for the lymph nodes, both the vertical lymph nodes and the horizontal lymph nodes. Starting with the horizontal lymph nodes, they should be just inferior to the inguinal ligament. Again, they should be very round, and make sure you let your patient know what you're about to be doing. But they should be round, very small, hard to feel. Check both sides. And then the vertical lymph nodes should run along the femoral vein. So if you remember your little word navel, nerve, artery, vein, lymphatics. So find the artery, then you go vein, lymphatics. You can check those vertically, obviously, both sides. And everything feels really well. So then the next thing I'm going to do is just check for a hernia. So I'll go on this side. So checking for a hernia, I'm going to feel it's right over the medial aspect of the femoral vein. So I'm going to place my fingers right on there, and I'm going to have the patient turn their head away from me and give me a cough. You'll probably feel some pressure as she coughs, but you're looking for a bulge, and I don't feel anything. So do the same to the other side here. Very good. Alright, so the next thing I'm going to do is we're going to do some auscultation of the femoral artery. So I'm going to have you, well, I will find the femoral artery, and then I'm going to have the patient place the bell of the stethoscope, the small end, under their shorts, right where my finger is, okay? So go ahead. And I'm listening for any type of bruit. Everything feels or sounds very clear. So I'll have you do the same thing on the other side here. Go ahead. Alright. Everything sounds well. So now we're going to be doing what's called Holman's test. And I'll get on the other side here quick. And what I do is I have the patient bring their, or I will bring the patient's leg up to about 45 degrees. And this is just checking for any pain or anything. So if I bring it here, do you have any pain? Mm-hmm. I'm looking for pain like in this area here. So she says no. And then I would dorsiflex the foot. Any pain?
Nope.
Alright, and then the last thing I can do is keep that dorsiflexion and squeeze the calf muscles. Any pain?
Nope.
No. Alright, and I would do that bilaterally. So, any pain?
No. Nope. Nope.
Alright, very good. So now we're going to do what's called the leg elevation test. So I would raise the patient's legs up, and I can kind of move them around or have the patient flutter their feet. Can you do that for me? And I would hold this position for about a minute, let the blood drain out of the legs, but just for time-wise, we'll say a minute has gone by, and then I would have the patient sit up and dangle their feet at the edge of the bed here for me. And I'm just looking for color to return back to the feet, and there's no problem there. So the last examination is called the venous tap test. So I'm going to have the patient stand up for me. Alright, can I hold this down up a little bit? Alright, and then you're going to make 2 contacts with the patient along the saphenous vein, one high and one low, about at the knee level along the saphenous vein. So the key to this test is you're going to want to tap on your upper, or your caudal, or cephalad contact. So I'm going to be tapping, and I'm going to be trying to feel for like a wave of blood to pass my lower hand. And I didn't. And then I would come around to the other side, do it bilaterally. Alright, so contact the saphenous vein, and then tap. And I didn't feel any wave of blood return, so you can go ahead and have a seat, and that will conclude the examination for today.